know what 411 is, and we all know how to use 911, but what about 211? I'm joined by Karen Milligan, Executive Director of Ontario 211 Services. So, Karen, what happens if I dial 211?
Thanks for including me today, and I'm happy to talk to you about 211. It is a phone line, a helpline, as well as an online service that helps people connect to the vast array of social, government, community-based services that are available across Ontario.
And this has been going before COVID-19, right?
Oh, absolutely. Yes, we've actually been in operation in Canada since 2002 and in the Kingston area since late 2011. So 100% of Ontario has 211 service, and it's been around for close to 20 years now in Ontario.
Oh, so now compare before all this happened, just compare last December to today. How have the
Mm.
calls changed? Are you getting more? And has the focus changed?
Good question. And so I will answer first to say, yes, we are absolutely getting more calls, certainly since COVID-19. And the nature of the calls has not really changed that much. It's just that now we're seeing more people struggling with the kinds of issues that we deal with on a day-to-day basis. So whether it's emergency food, financial assistance, or a number of other mental health support lines. These are things that more and more people are now looking for that may never have had to access before.
What do you find is that the biggest surprise people have? Oh, you do that. I can do that. What do you find?
I think a lot of people are really not aware of the services that are available in communities, and whether they're provincial in nature or whether they're offered by local organizations and funded by your local United Way, for example. 211 is able to help connect people to that vast array of services because many are offered by small nonprofits who just don't have the resources to be able to advertise and promote their services, especially when you're not somebody who would typically access that kind of a program.
So it's like one-stop shopping in a sense that they could find out if they have numerous needs, and especially now when they've
Hmm.
never had to access these things before, they can call one number at three
Hmm.
digits and get what they need.
Absolutely. Yeah, and the other benefit of 211 for people in all parts of Ontario is that it is a 24/7 service. So no matter what time of day or night, when a lot of the other services that people may depend on are closed, they can reach a live voice in the middle of the night and discuss whatever issues they're having, and at least set a plan for the next day to act on those referrals and contact those services.
You talked about why people should call and let serve services, but when is it not appropriate to call 211?
Great question, and especially timely given the number of people that are calling places like telehealth these days to try and get information about health specific questions that they have. Um, and we know that the wait times for those types of services, including local public health units, are quite long. All to say, 211, we're not medical professionals, so we can direct you to those lines if you don't know where they exist or how to access them, but we're not going to be able to provide medical advice. Rather, we'll redirect people to where that authoritative information can be found.
So don't call expecting that this is where you're going to get your health information. It
Absolutely.
also leads me to wonder, do people think this is like a suicide hotline
Mm.
type of services? Do you get that kind of call?
We do absolutely get those calls. And even though we don't advertise ourselves as a crisis service, quite often people aren't aware of those local suicide prevention lines or distress centers, and they might not remember the number. So because 211 is an easy to remember number, we quite often get those calls, and our frontline staff are trained in suicide prevention and crisis intervention. And we have very complex and detailed protocols with 911 and with other distress lines so that we can make sure that those people can get to a crisis line as quickly as possible.
That is such good information. And just one more question. Are your employees working from home?
They all are, yes. And it's, we're very fortunate because the type of work that we do is virtual anyway. It's, for the most part, we don't deliver any in-person services. Having said that, most of our staff did work in a call center environment. And so that working from home has been an adjustment for sure. But we're finding new and wonderful ways to support people in that home environment.
This is interesting. I really had no idea about this. So I am so glad I talked to you today. Thanks so
Oh,
much for
glad.
being with us.
Oh, thank you so much. Thanks for having me. And hopefully now a few more people can learn about 211 and give us a shout.